Hello, my name is Victwan. I am a 2022 spokesmodel with HIV Stops With Me campaign. I'm here to answer the question of the month for July. And the question of the month for July is, as someone living with HIV, what does healthcare is a human right mean to you? Share a story or experience of how this has showed up in your life. Well, to me, I guess I have to start with healthcare is a human right means everyone is entitled to free and equitable healthcare, meaning everyone gets what they need when they need it. Uh, and I think that as far as a story or an experience of mine, I was diagnosed in 2003 here in New York City. By then, the city had made huge strides toward equitable healthcare across the city. Um, we had things like HASA and Medicaid. We had HIV specialists and clinics dedicated just to servicing people living with HIV. We had community-based organizations with built-in clinics providing various services. In fact, when I was diagnosed, it was through one of those community-based organizations. I actually lived there. I got mental health services, primary care services, specialty services there. I attended groups. They had an adult day treatment where I learned a lot about how to effectively live with HIV. Now, I've heard some horrible stories, and I got anecdotal stories of how horrible it is so many places outside of New York. My entire experience with my HIV has been managed here in New York. And I'm not saying it's perfect. It's far from that. But I think majority of the services I've accessed came from a perspective where everyone is deserving of healthcare. The only hiccup I had in New York City as far as accessing services and taking care of myself was when I went back to work. You see, Medicaid in New York City is like a black card for medical services. There's nothing it doesn't pay for, just about. So when I lost that, when I went back to work and I got private insurance and no longer had Medicaid, I had to figure out a new way of navigating the same system. And I started to see disparities in ways I hadn't seen before. For example, I firmly believe that healthcare should be free. It shouldn't cost you to stay alive. But when I switched to my private insurance through my company, I found that I couldn't afford to take care of myself in the way that I could before. I could not see my primary care doctors often. I had a copay now, and I had to be aware of whether I had money or not in my account to pay the copay in order to actually see my doctor, because it wasn't like it is with Medicaid where they have to see you, they can just bill you. So it was some adjustment. I saw my providers a lot less. I didn't take as good care of myself as I could have. But then I found out about a thing called ADAP and ADAP Plus, and ADAP Plus is a program intended to improve the inequities in healthcare by covering everything that Medicaid pays, covering everything that Medicare covers. So I no longer had co-pays when I got my ADAP. I was able to have access to more service providers and get acclimated and back to the level of healthcare that I was at before I lost my Medicaid. But outside of things like that, I found that New York, staying and living in New York, has been a blessing for my HIV care. I know that down south it's a lot worse. I've gone to conferences where people have spoken about how much I take for granted and about what we have here in New York that is just not offered almost anywhere else. It amazes me because it's not my personal experience, so I don't want to really get into those stories. But yeah, I think that healthcare is a human right in a way that everyone is entitled to be healthy. I think the system that we live in is crazy, that we have to pay for healthcare, and depending on how much you can pay, determines what kind of care you actually get. It makes no sense to me. It's just, as rich as this country is, we shouldn't be going through what we're going through on that level. But Um, in New York, there are a lot of programs. There are, in New York, we have an issue of people accessing what we have because it's so much. And some people don't know it's there. So I'm always willing to talk to people about the services that are out there, the help that you can get, and how good we have it here in New York. Now, there's a lot of work that still needs to be done. But I think by 2022, at least healthcare wise in New York City, we've come a long way. Thank you. And you have a beautiful, beautiful July.